everybody, Josh Sigurdson of World Alternative Media here. We are here at Freedom Meet in beautiful Vancouver, British Columbia, and I wanted you to introduce yourself to our audience. So can you tell them who you are and what you do?
Absolutely. So my name's Alissa Taylor, and I actually work in the healthcare system right now, working for a disruptive health startup. In the past, I've worked for the public healthcare system as a case manager as well as a kinesiologist, and in the private health sector as well, doing medical assessments.
Now, I find this is a really important issue because obviously health is key to life, and I think that goes without saying. And when you look at this government, manipulated government-run healthcare system, there's little room for innovation. There's little room for competition. You basically are pigeonholed to major pharmaceutical companies that are, subsidized and major insurance companies that are monopolized. So, how important is it for people to get out of that system, and how simple really is it in a country that's so socialized like Canada to go and get private health care?
I would say overall, it's pretty complicated, actually. There's quite a few barriers to entry. The big thing that I would say is just learning to take control of it through knowledge. So research, taking care of yourself, keeping track of your health, your exercise, your mental health. Utilizing your extended healthcare benefits, looking into alternative therapies. As far as the public healthcare system goes, there are so many barriers. Even companies like mine currently face challenges getting buy-in from public healthcare. So the big thing is be loud about it. If you have a desire for change, mention it. Look into alternative telemedicine, look into alternative applications and things like that. If there's a demand for it, there could be a change.
So, can you tell our viewers a bit about what you've done to kind of try and pull it into the more private direction and help people actually get that kind of care?
Absolutely. So the big thing I've done in the past as a clinician is really emphasize triage or multidisciplinary therapies and care. I've always advocated for getting a second opinion. To not just go to a hospital or something like that and be faced with those wait times. There's plenty of doctors that actually will privately look into files and things like that. So if it's possible, if you have a complicated or challenging chronic illness, look into getting a doc review from a doctor. That's something that most people don't know is possible, and it's not that expensive. Especially it pales in comparison to the cost of what it is in the United States, and you can get a decent answer from there. Does that answer your question?
Yeah, what's the name of the company that you are running at this moment?
I don't run the company, but the company I'm working with is ETreatMD.
Okay. So where can people find more of what you're doing and get involved and perhaps support this company?
So they can actually just go to ETreatMD.com. which will give you the full overview. You can request a demo from there. From there, you can actually start tracking your own environmental factors, your symptoms, use the imaging technology, and at minimum have more productive information to divulge to your healthcare clinician.
Absolutely. Good health starts with individuals freely deciding to do what they need to do for their own health. And obviously, when we are in a system that's so incredibly socialized, it's so important for people to be able to break free from that. Obviously, from my personal knowledge, just being someone from Winnipeg, having had like horrible head pains in the past, I was slurring my words. I wasn't sure what was going on. The doctor said it could have been a stroke, and which tells me it's pretty serious. And after waiting 12 hours in a waiting room, they bring me in and tell me they've scheduled an MRI for 9 months from now. And this is something that should not be acceptable by any standards whatsoever. So I think it's so great that people in that situation, people who have cancer, actually I want to break away for one moment and mention Jack Layton, who was, of course, the leader of the NDP in Canada. He was a huge champion for government healthcare, and then when it came to the end of his life, when he was battling cancer, he ended up going over to Europe, I believe, for his care. And it just goes to show, even the people trying to sell it aren't believing in it. And it's so important what you do. So I really appreciate you talking with us today, and we hope to talk to you again. Now to sound like an auctioneer. Thanks for watching, everyone. Check the links below. GoFundMe, Patreon. We can't do it without you. Any donation is very much appreciated, especially as we are so vastly demonetized and censored by YouTube as they bring in the Anti-Defamation League to flag all of our content as hate speech. Also check our Bitcoin address in the description in the comments, as well as on the screen for you to scan if you please. And don't forget to check me out at Josh Sigurdson at steemit.com. That's steemit.com, the future of social media, where you get paid via cryptocurrency, Steem that is, by the upvote and demand of your post. It's bound to take out the dinosaur social media, so I hope to see you there. But until next time, find the truth,
Be the change.
Bye.